Hello, I'm Dr. Trivedi, a doctor working here in this clinic. May I confirm your Simon Gray, 28 years?
Yes, Doctor, I am.
Okay, how may I address you?
Please call me Simon.
Okay, Mr. Simon, today we are going to discuss about your health issues. Is that all right?
Okay, Doctor.
Okay, Mr. Simon, can you please tell me in your own words, actually, what's your health problem?
Actually, Doctor, for last couple of weeks, I noticed that I have some back pain. This wasn't present before. I was somewhat fine with that, but recently that was also make me somewhat feeling less better, much worse because I also have some difficulty in walking these days now.
Sorry, can you please repeat actually for once? Previously, I couldn't just get it. There was some problem in the sound.
Okay, Doctor. Actually, I had some problem in my back. I some felt some back pain for last couple of weeks. That was not so severe, but for last few days, I have noticed also some difficulty in my walking that make me feel worse. After that, I visited my GP, and my GP sent me here. He thought that I have something abnormal.
Okay, I can get it. I will try to find out the cause. Okay, can you please tell me actually where did the pain started in the back?
Uh, Actually, Doctor, exactly to say, it is over my buttock area on the right side.
Your buttock area. Okay. And did it come suddenly or gradually?
Gradually.
Okay. How long does this continue? This pain nowadays?
This pain comes mostly when I try to do any work, when I try to move my legs at
Okay.
the time, not at rest.
Okay. Can you please tell me how severe it is?
It's not so severe, doctor. I told you that I wasn't
Yeah.
worried about the pain. I think it is.
Okay. If you say that zero is no pain at all, but and uh, yeah, 10 is the highest pain you can feel, then how would you grade it?
I would tell it is 4 out of 10 or 5 out of 10.
Okay. And can you please describe the pain for me? How is the pain?
Some aching pain, doctor.
Okay. And is there anything that makes you feel better?
If I take rest, I feel better.
Okay. And anything making you worse?
Yes, doctor. I told you that any
Yeah,
movement.
yeah. Okay, okay, I can get it. And do you think that the pain spreads to somewhere else or just stays in that area?
That area, only that area.
Okay, and may I ask you now that do you have any headache?
No,
Okay, any problems in your vision?
no,
Okay, and uh, uh, any raised temperature?
no.
Any changes in your weight recently?
I think I am gaining weight.
Okay,
But
okay.
yes, I
Is it
have no
intentional or
intention for that.
non-intentional?
Non-intentional.
Okay, and which part? Can you please tell me? Whole body or any specific parts of the body where you're gaining weight?
I think my tummy is much
Okay.
more bigger, and I am having
Oh, yeah, yeah, yeah.
little bit
Yeah,
more
yeah.
belly.
Okay. And have you noticed any changes in the skin in these areas?
Yes, doctor. Some scratchy mark. I think they are present.
Okay. And may I ask you that do you have any chest pain?
No,
Any shortness of breath?
no,
Okay. Any racing and pacing of your heart?
no.
Any noisy chest?
Doctor, I have asthma for a long time,
Okay.
and
Okay.
that is not well controlled. For that, I need to take some inhalers, some tablets.
Okay.
When I feel worse at that time, I feel that I have shortness of breath. I have noisy chest at the time.
Okay. May I ask you that when did you last go to your chest doctor for your asthma control?
About 3 months ago, actually, it is not well controlled. So he gave me more medication, 2 inhalers, and also
Right.
2 tablets. One is Montelukast, and another I that is called for prednisolone tablet.
Okay.
I have,
And yeah, yeah. Please continue.
and I am taking those, doctor, see,
Okay.
for a long time.
Okay, may I know that is what is the color of the inhaler? It is a brown one or blue one?
To both.
Both. Okay. And at the about the prednisolone tablet, how long have you been taking this tablet?
Actually, doctor, my doctor said that to take it only for a week if I feel a much shortness of breath. But after, if I don't take this tablet, I feel again shortness of breath, and for that I actually take most of the days.
Okay. And when did you first start taking it? 3 months back. This.
No, it is about 8 years.
Okay, for about it. Okay, I can get it. And may I know that have you been taking any other protecting medication besides actually, if you take prednisolone, at times it's necessary to take some other medication for your protection, like uh, for for a bowel, some tablets, okay, for antacid tablets or something like that, and also something for bone protection. Have you ever taken anything?
I took calcium initially, but I am not taking for a long time.
Okay, that's all right. And may I ask you that? Okay, what about your water work?
It's fine.
Okay, and what about your bowel movements?
I think it is normal.
Okay, and do you have any family history of similar diseases or anything like that?
No,
Okay, and do you have any past medical history apart from your asthma?
no,
Okay, and may I know what do you do for a living?
I am a shopkeeper, doctor.
Okay, and I would like now to examine the patient.
Okay,
And first, I'm going to have a look at his face. Okay, and I would like to open his mouth and look at around his surroundings, and then I would like to request him to pull off his shirt. Okay, and then I would like to look at his shoulder region. Uh, yes, okay, and shoulder region. Okay, and then I would like to look at his skin, whether there is any skin bruising or purpura present or not skin thinning present or not. Okay, and then I would like to measure his BP. Hmm. Oh, and
it
sorry,
is
I would like to
150
look at.
190.
Okay, sorry, what?
150 190. 2 minutes remaining.
Okay, okay, and I would like to have a look at his back. Okay, and back, and I would like to palpate the back, whether there is any tenderness present or not.
No.
Okay, no tenderness. Okay, and yes, and now I would like to also do the have a look at the observation chart and do the urine dipstick test and also measure the blood glucose, random blood glucose. Okay,
Random RBS is 30.
13.
Yes.
Okay, and may I know that? Okay, and may I ask you some other personal questions if you allow?
Okay.
Okay, do you smoke?
No.
Okay, do you drink alcohol?
No.
Okay, and may I ask you another personal question, that whom do you live with?
My wife.
Okay, are you well supported economically and socially?
I think I am.
Okay, and during this during this last 2 weeks or some days, have you ever experienced any fall?
No.
Okay, that's all right. May I know, Mr. Simon, what your concern is?
Why I am having this
Yeah. Actually,
problem in my
Mr.
walking,
Simon,
doctor?
Mr. Simon, as long as I have examined you, and I think that your problems might be caused due to your prednisolone tablet intake. Okay, when this tablet is taken for a long time, and at times it can affect the bones. Okay, and I suspect that you might it can actually weaken the bone, and at times there can be some bone fracture present. Okay, and I think that your present problem, that it might be caused by a fracture in the bone. Okay, but for that I will have to do some blood test, also some scanning tests of your back. Okay, and I will also have to involve the bone doctor.
Time up.
And okay.
Okay. So have you reached a diagnosis?
I think that the patient is suffering from osteoporosis due to osteoporotic fracture due to iatrogenic Cushing's disease, Cushing syndrome.
Okay. Fracture at which side do you suspect?
Uh, I think the fracture is in lumbosacral region.
Okay. Why do you suspect it is a lumbosacral lesion? Fracture is lumbosacral lesion.
Well, actually, I think if it was a thoracic region fracture, I think he would have complained about some chest pain or something like that. I think he didn't complain anything like of that.
Okay. Do you think that he may have a fracture at the neck of the femur? or any avascular necrosis
Yes.
at the head of the femur?
Yes. 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 Yes.
Okay. So how do you investigate him?
Well, for the investigation, at first I will have to do some baseline uh, blood tests like complete blood count with with ESR and CRP to find out whether any inflammatory condition is present or not. Or in CBC, I might also find some reduction in basophil, eosinophil, and lymphocyte count, and then I would like to have to do plain plain X-ray um, of both lumbosacral spine, AP view, and also including and plain X-ray, sacroiliac joint along with the both hip joints. I think okay, AP view, and I might also go for MRI of the same region, and at the same time I would have also have a look to confirm that iatrogenic Cushing's. I would like to do some tests like overnight 24-hour urinary cortisol level, and also overnight dexamethasone suppression test.
Okay. How will you manage him if it is a case of avascular necrosis of femur?
If it's a vascular necrosis, I think it will be a medical emergency. And I would have to admit the patient. Then I will have to educate and counseling the patient, and also have to form a multidisciplinary team involving the physiotherapist, the orthopedic surgeon, and orthopedic surgeon, and I would have to then I think there might be some surgical treatment for hip replacement or osteotomy. I think I'm not quite sure at this moment, and also I will have to reschedule or rethink about his prednisolone medication, how to taper it down, and also also involves a bone protection for the patient.
Okay. Thank you.
That was a disaster.
Okay, actually, for this case, presented with back pain, actually the pain was in the buttock region and around the groin region. Okay, and this was a case of avascular necrosis of hip. You have started. You have asked the site. You have asked the onset. You have asked the character. You have asked the radiation. You have asked the associated symptoms. For associated symptoms, he was saying that he has problem in walking.
Yeah.
Okay. Yeah. And after you seeing the patient, you came to a diagnosis that this is a case of Cushing syndrome, isn't it?
Yeah.
So Cushing syndrome is present with osteoporotic fracture of the that is called spine or hip. Already told you that pain is at the buttock region, and if you could tell him to show, then or if you could ask that if it is around the groin region, then he would say yes. It's more on the groin region. You haven't asked, or your mindset that it is a case of fracture of spine. I think.
Yeah, I just totally got blank. I just forgot. That's the main fact. I was very weak in this case.
Okay. Then severity. For the severities, the pain wasn't severe, and also it was affecting his jaw. Then past medical history, he has you have asked about past medical history, that asthma that is not well controlled, and he is taking irregularly prednisolone tablet. Okay. And after that, family history, that was drug history. You have asked that about drug history. Is he taking any other medication? I cannot remember that if you asked any other. Okay. Then family history, then personal history went for that well. That was fine. That smoking increases the risk, and also alcoholism increases the risk. And in the examination, I was extremely dissatisfied with your examination because you went for the Cushing syndrome. That was fine, but patient's main complaint was back pain. That is
Yeah, yeah,
like
yeah. I just
it actually came that pain at the buttock region or groin region, and also he complained that he has difficulty in walking. You haven't even wanted any permission to that you want to examine his leg. At least you could see the gait. At least.
yeah,
And
yeah.
after
Well, in
some,
late examination, what should have I done?
okay, after you should have examined the gait, then any shortness of leg. That is, usually one leg is shorter than the other. If there is any fracture at neck of femur or sometimes at osteoporotic, or that is necrosis of hip.
Mm-hmm.
Okay,
Okay.
and any specific movement bring the pain or not. Okay, and after that you could
Sorry, what?
any specific movement that brings the pain or not.
Okay.
And after that you could have advised him that at this time you should walk by using walking aid, and at this point I think you will need urgent evaluation by the bone doctor.
Okay.
Okay,
Well, if admission needed in this patient,
patient needed admission.
whether whether it's needed or not.
I think he doesn't need admission. It can be managed at outpatient basis.
Avascular necrosis can be managed at outpatient.
Yes, but on urgent basis.
Or from outpatient, but on urgent basis. Okay.
Yes, with some advice for his walking aid and giving
So,
some other medication in the time being.
I think osteoporotic fracture also can be managed outpatient.
If it involves the bowel or bladder or any sensory
Okay.
involvement, any plantar
Yeah.
involvement, then it needs admission.
Okay.
Okay, and also for this patient complained of pain, you haven't offered any painkiller for that. Okay, in the management point, you should have asked, yeah, you should have told till that you want to also offer painkiller medication. Okay, and his BP is high, and you are suspecting Cushing syndrome, you should have asked for fundoscopy also, and also diabetes.
I think I asked for diabetes.
Fundoscopy.
And movements. How can I do the movements? Could you please help? Which movement would be
Okay,
important?
you have asked the gait, and after that you can do the flexion, extension, abduction, adduction of the hip joint, if any brings the pain or not.
Okay. And the treatment, if in a treatment, I think then I had done totally wrong. I should have told that, okay, I think we can manage you at an outpatient basis, but urgently, I would have to involve a multidisciplinary team, okay, involving physiotherapist and or bone doctor and physiotherapist, okay, and I will also have to, I would like to give you some painkillers for your pain, and you should also use walking aid, and I would also like to taper down your dose of prednisolone by consulting with the chest physician or the respiratory physician, and also have to would like to add some other bone protecting agents. এগুলো বলতে হবে না?
Hmm.
Oh, sorry, should I tell this?
Yes, and also for
Okay.
the leg examination, you should do the sensory examination, sorry, neurological examination of the lower limb, plantar involvement, and any sensory impairment.
Hmm.
Okay, fine. This was fine. I'm going for the next case. Okay.
Okay.
Start.
Hello, this is Dr. Trivedi, doctor working in this clinic. May I confirm your name and age, please?
Yes, doctor. My name is Joe Montelanta. I am 58 years.
Okay, how may I address you?
Please call me Joe.
Okay, Mr. Joe, today we are going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, and can you please tell me that what have brought you here today?
Actually, doctor, for it is not a very new thing. For a long time, I am having this shakiness on my hands, especially on my right hand. It's more on the right hand, but I present on both hands, and that comes on certain occasions mainly, more at certain occasions mainly, and that is not hampering my life actually. But my father had been diagnosed with the Parkinson disease a few months ago. So I am really worried if I am having this, and I heard that Parkinson can also run in family.
Yes, okay, I will try to find out what's troubling you. Okay, but can you please remember that actually when did this first start, this shakiness in your life?
For a few years, I cannot exactly tell you. Maybe
Okay,
3 or
that's all
4 years.
right. Yeah. And has it always been same in frequency, or do you think that it's increasing or decreasing?
Increasing.
Increasing. Okay. And has it always been on the right side or left side also?
Both side, but more on right.
More on right. Okay. And okay. And have you? Can you please tell me that how severe it is?
Now it has become somewhat severe because I am a office clerk, and my handwritings have become so much ugly that even sometimes I cannot read my writings.
Okay. Okay. And okay. And have you found out that is there anything specific that makes it worse?
Sometimes when I try to suppose I am trying to eat a cup of tea, that makes me
Mm.
worse. I am trying to writing, that makes it worse. Otherwise,
Okay.
otherwise at normal time, I don't have any problem if I don't do any
Okay.
work.
Okay. And have you found out that if you want to reach a target by your hand, this increases or something?
No, nothing happened like that.
Okay. I'm sorry to ask. And may I ask you that some other questions now? That do you have any dribbling of your saliva?
No,
Have you?
no, no, no,
Okay. Any difficulty while turning in bed from
no,
one side to side?
no, no,
Okay. And any difficulty in starting any movements? Have you found out?
no,
Okay. And any difficulty in keeping your balance?
no,
Okay. And in any okay. And do you have any weather preferences?
no,
Any changes in your weight?
no,
Any racing and pacing of your heart?
no,
Any sweating or something like that?
no.
Okay. And may I ask you that do you have any head nodding? Have you ever noticed?
Yes, doctor. That is also
Okay.
a thing, but my elder brother and my father also had that.
Okay. And do you have any abnormal sensation around your mouth or somewhat like that, or in your hand? Okay. And may I ask you that? Okay. And may I ask you some other questions now? Apart from your father's Parkinson's, do you have any other significant history in the family of such shakiness or something like that?
My elder brother had also this type of symptom, but he doesn't do any job, so it is not a problem for him.
Okay. And okay. And may I ask you that? Do you have any other known diseases?
I had asthma in my childhood, nothing else.
Asthma. Okay. And how is it? Is it well controlled or not?
No, I am not taking drug for about 50 years.
Okay. And do you take any other medication?
No.
Okay. May I ask you some personal questions if you allow me?
Okay.
Do you smoke?
Yes, doctor.
How many sticks for how long?
About 5 sticks for last
Okay.
30 years.
Okay. And smoking is actually very harmful, and I would like you to stop it. If you want, we can refer to smoking cessation clinic. Is that all right?
Okay.
And do you drink alcohol?
Yes, doctor, but on a social limit.
And do you know about the social limits of alcohol?
Yes, doctor.
Okay.
Seems
And
like
have you noticed any change
10
when you drink alcohol of your shakiness? Have you ever noticed it?
Yes, doctor. After taking alcohol, I feel somewhat better that my shakiness is gone. But
Okay, okay,
I don't take much alcohol for that.
okay. And may I know that do you drive?
Yes, doctor. But driving has,
Okay,
I have quitted driving because I think that it might affect my driving.
okay. May I now examine the patient?
Okay.
I would like to keep the patient's hand on a pillow and at the beginning to rest him, and then I would like to tell him to extend the hands, okay, to see whether there is tremor present or not.
Yes.
Okay, and then I would like to tell him to cock up the wrist and spread out the fingers. Any flapping tremor?
No.
Okay, then I would like to tell him to make an O sign with index finger and thumb,
Okay.
and then I would like to tell him not to allow me to open it,
2 minutes remaining.
not to allow me to open it.
Okay.
Okay,
Intact.
okay, and
Normal.
press up against my hand with your hand to
Can
check
do
radial
that.
nerve. Okay, and then can he please do like this? Can he please button and unbutton his hand
Yes.
with the shirt? Okay, and can he please do the rebound phenomenon by alternating with on the hand?
Yes.
Okay, and then finger nose test.
Yes. We can do that.
Okay, and then I would like to have check his pulse
78 beats per minute.
regular.
Yes.
Okay, and I would have to look. I would like to have a look at his heart, whether any abnormality is present or not.
What type of abnormality you suspect?
Any types of atrial fibrillation or not. Although
No.
I checked with pulse. Okay, and I would also like to have a look whether there is uh, any mark for blood glucose measurement or not.
No.
Okay. May I ask you another question? That do you have you ever had any high blood glucose? Have you known any?
No.
Okay,
It
that's
was
all
quite
right.
good.
May I know, Mr. Joe, that what your concern is?
I told you, doctor. Am I having this Parkinson disease?
Well, actually, as long as I'm concerned, that as long as I have examined you and took history from you, I think that you might be suffering from a condition named benign essential tremor. Okay, so actually, this can run in your families, and I think that your brother might also be affected by this. Okay, and actually there are certain medication there you shouldn't be very much worried about it. It's actually a very benign condition. It's not very much harmful.
But it is
How,
affecting my job, doctor. I told you that I cannot
yes,
write.
yes, I can get it. I can get it, and for that actually I'm going to prescribe you some medication which is actually named beta blocker. Okay, but since you have asthma, we will also consider that whether we can add some other drug other than beta
Time
blocker.
up.
But okay. Mhm.
Okay, have you reached a diagnosis?
I think the patient is suffering from benign essential tremor.
Okay. Do you have any other differential diagnosis?
Differential, I think it can be regarding his age. It can be Parkinsonism, tremor due to Parkinsonism.
What are the points in favor of benign essential tremor?
The tremor is more. It's an action tremor, I think. Then it's uh, relieved, markedly relieved by taking alcohol, and also there is head nodding present and family history present.
How will you manage him?
First of all, patient education and counseling. Then in the counseling part, I would like to tell him to stop driving as well, and also discuss about the disease itself. And then I would like to form a multidisciplinary team involving physiotherapists and also occupational health service, uh, since his occupation is his work job life is being hampered. And then I would like to go for specific management treatment, and this might include, usually it includes beta blocker like propranolol and also primidone. But regarding his asthma, previous history of asthma, I would like to take opinion from the respiratory physician whether to start with propranolol or start primidone. I think these are the important issues, and also uh, I would like to advise him to take tea and alcohol, tea and coffee within a social limit. I think that's also important.
Okay. I think your history taking was fine.
Okay.
Something I think you should have asked about any tremor during sleep is present or not, if anyone has noticed.
Okay, well, what would be tremor during
Tremor
sleep?
absent during sleep.
If present in sleep, then
During sleep, it is not present.
yeah. Okay, another ones.
And other thing in the examination, I think you should have asked, you should have seen the gate and planter. You missed that.
No. Well, may I ask that why gate for cerebellar?
No, you are suspecting that you are ruling out that he's not having any Parkinsonian gait.
And plantar?
Any stroke is present or not.
Okay. Actually, that's very important because even in stroke, I think this clumsy hand syndrome might be present. Am I right? Lacunar stroke.
Yes. And also patient have history of doing such type of job. He said that Papa tremor is more at taking holding cup of tea during writing. That is actually, I think, postural tremor. Certain posture or certain action of exaggerates the symptoms.
Okay.
No,
And I
and
actually,
action type tremor is actually cerebellar. This was not action type tremor.
well, can you please help me to differentiate these two type of tremors, postural tremor and action tremor?
Action tremor comes when it tries to do any jobs, and postural tremor occurs during any specific posture, like hand at certain position, any holding position, writing at certain position that
Okay.
brings the condition. But action, all type of action.
Oh, that's okay. That's important. I actually had some confusion. Okay, and anything to be discussed? And I think I should have also asked whether he had any previous history of stroke. Am I right?
Yes,
Or heart
so
attack?
any injury, injury to the head. I think you have asked any injury to the head. I cannot remember.
I didn't ask that.
Okay, I forgot then.
Yeah. So previous injury to head, stroke, this should have been asked. Okay. Anything more?
I cannot remember.
Okay. Anybody wants to add anything? Sonyapu is present. Okay. So I think